This is our patient Daisy Watts. She is currently intubated for mechanical ventilation and also has IV antibiotics. The nursing interventions that need to be undertaken for Daisy Watts include administering medications that were ordered, monitoring SpO2 and EtCO2 regularly while patient is on ventilation and report any changes to the physician, obtain ABGs as indicated or ordered and then monitor and report the results, to maintain clear airways, suction via endotracheal tube, monitor vital signs every 1 to 2 hours, assess capillary refill, skin colour and the presence of edema at least every 4 hours. Every hour monitor urine output, and if it is less than 30 mL per hour, this needs to be reported. This also includes fluid management and monitoring for dehydration and overhydration. Assess chest excursion and lung sounds every 1 to 2 hours. Ensure patient understands the importance of remaining in prone position and regularly observe patient to ensure they have remained in the prone position. The 4 nursing interventions that we will be focusing on include obtaining ABGs as indicated or ordered and then monitor and report the results. Every hour monitor urine output, and if it is less than 30 mL, this needs to be reported to the physician. This also includes fluid management and monitoring of dehydration and overhydration. Ensuring the patient understands the importance of remaining in the prone position and regularly observes the patient to ensure they have remained in this position, and monitoring vital signs every 1 to 2 hours.
According to the NSQHS Standard 3, Preventing and Controlling Healthcare-Associated Infections, we can stop the spread of infections by conducting hand hygiene before and after procedures and before touching patients.
Very important to remember NSQHS Standard 5, Patient Identification and Procedure Matching. This involves checking the name band before procedures, such as medication administration, and checking the name is the same on the chart.
According to Ms. Watt's condition, she needs checking vital signs each 1 to 2 hours. Vital signs assessment is important in determination of a patient's health status and a core function of registered and enrolled nurse midwife. An alternation in patient vital signs can provide objective evidence of body's response to physical and psychosocial stress or changes in physiological function. Aim of doing vital sign and patient observation are monitoring of physiological variable to evaluate treatment effective, to maintain throughout assessment of inpatient within a tertiary referral hospital 24-hour a day, early detection and treatment of post-procedure surgical complication, and early detection and treatment of deteriorating patient.
The next nursing intervention includes obtaining ABGs as indicated or ordered and then monitor and report the results. So when is an ABG analysis needed? Some of the common indications of ABG analyses are respiratory compromise, which led to diminished ventilation or hypoxia, during the perioperative phase of surgeries, preoperative, intraoperative and postoperative care of the patient, peri or post-cardiopulmonary arrest. The physiology of ABGs includes PaO2, SaO2, PaCO2, hydrogen ion concentration and HCO3, serum levels of hemoglobin, glucose, lactate, base excess electrolytes, Na+, K+, Ca+, and NaCl are the components of an ABG analysis. When a patient is on mechanical ventilation, the aim is to improve oxygenation and ventilation. Analysis of ABGs can guide health professionals such as nurses and doctors in titrating ventilator support and weaning. It is important for nurses to monitor ABGs as the patient's oxygen needs are reflected in the PaO2 and SaO2 parameters of the ABG. Using P, positive end expiry pressure, and increasing the FiO2 are key means to improving oxygenation. Ventilator support for minute volume may also need to be increased, and FiO2 and/or P may need to be weaned, as the mechanical ventilator may eliminate hypoxia, but there still may be abnormal PaCO2 levels. Increasing the minute volume allows for PaO2 levels to decrease. This reiterates that ABGs need to be obtained, interpreted and monitored, and any changes should be reported to the doctor, as the patient's ventilator modes settings may need to be adjusted to meet the patient's needs.
The next nursing intervention is ensuring the patient understands the importance of remaining in prone position and regularly observing the patient they are still in prone position. Positioning a patient in ARDS in the prone position with chest down and back upwards has been shown to reduce the mortality rate in patients with the condition who require ventilation, as it has shown to reduce hypoxia and prevent the lungs from overinflating and experiencing further damage. In a more in-depth study conducted by Guerin et al. Involving 466 patients with severe ARDS, it revealed that there was a 16.8% reduction in 28-day mortality and 90-day mortality of patients who remained in the prone position for a prolonged period of time compared to patients who remained in the supine position for a long period of time. The study also found that early application of prolonged prone positioning played a crucial role in reducing mortality among patients with severe ARDS. It is important for the attending nurse to educate the patient that staying in the prone position for a prolonged period of time may play a crucial role in their recovery, and the nurse should regularly observe if the patient and for how long the patient is in the prone position.
Is fluid balance management. The quantity of fluid given to the patient should be monitored, as our goal is to remove excess alveoli fluid and allow efficient transport of fluid in the body. The fluids are usually given through an IV line. The ARDS Clinical Trials Network conducted a study and showed results that conservative fluid therapy may be an option to guide fluid management. Results from the study have shown a reduction of the number of days on a mechanical ventilator, improved oxygenation, and shortened the stay in ICU by decreasing pulmonary capillary hydrostatic pressure in patients. Fluid deficiency. The lungs are usually full of fluid, but the patient is hypovolemic and is unable to maintain adequate blood pressure, thus resulting in hypertension in patients. So to tackle this, we have to monitor urine output hourly and to assess for negative fluid balance. And if the output is less than 30 mL per hour, this needs to be reported and documented. Fluid overload is usually due to the leaks in the lung tissue through the capillary membrane. This fluid overload reinforces the idea that we need to monitor the lung fluid balance. And if fluid deficiency or overload is detected in the patient, it needs to be reported to the physician as soon as practical. Should be there, definitely.
Go.
This is bed number 2. She's Mrs. Daisy Watts.
And I'm like,
Oh my God.
are you serious? And she goes, yeah, I just did it. And I'm like,
She was this.
patient Daisy Watts. She is, what the hell?
It's really loud.
okay.
Okay. I'll just have to. Yeah, that one's quieter. Okay.
Alright, ready? Go. Medication safety. It is important to sorry.
The first drug on the list is
dexmedetomidine.
Tazocine used to treat bacterial infection of lower tract.
To aspirin or another non-steroidal anti-inflammatory agent. You click too fast. Wow.
Yeah.
Being allergic to piperacillin and tazobactam or any of other indication of the medication. An alternation in the patient vital sign can provide
In a more in-depth study conducted by Guerin et al. Involving 440
440.
What are you doing? Sorry.